Nadia, are you able to hear me?
Yep, I can hear you.
Oh, fantastic. We are ready to start when you are, my dear.
Okay. All right then. Good afternoon. Thank you all for joining us today. My name is Nadia Sadi, and I am the current chair of Buffalo County Community Partners. And I would just ask if everyone can just drop your name and the organization that you're associated with as an introduction in the chat box so that we can capture that. That would be great. And I would like to thank those of you who started this process with us earlier in the year and for coming back to the table to continue this work. I think we can all agree that Kearney is a community of passionate people. And I heard somebody say at an event earlier this month, a community who doesn't do anything small. So I'm confident that I'm in good company. So while we're waiting for everybody to finish dropping their name in here, we're going to get started on our PowerPoint. So we are on a journey. We started this journey. Well, I guess we can't really say we started, but our focus really started the end of 2019 and early 2020. And we would like to present this work to you, our community partners. Community Partners is willing to serve as a backbone to this work. And through the course of this year, we have heard from some amazing partners in all sectors, public, private, nonprofit, people with ideas and aspirations to work together to be change agents for our community. What do we hope to achieve? What is the impact that we hope to achieve? Although I think everybody would agree that we would all hope for that one magic intervention that would have a measurable effect. We recognize the complexity of life and the many events that interact to influence the issues in our community. So by looking at the needs and challenges in our community and formulating a collective approach, we hope to have a greater impact. This work has and will be based on historical data. What we hope to achieve by gathering is to gain a greater understanding of our community needs. And we also hope to learn what is missing or something that we have not heard yet. Our other hope is that we will garner support from our partners to move forward in bringing more community partners to this conversation. So we look to you who are in attendance today to help guide this work, as you have already shown a vested interest in moving this community vision forward. So as we move through this meeting today, I would invite you to just consider who is missing from this conversation. And we will talk at the end of the meeting about next steps. So I would like to introduce Travis Gregg, who has agreed to be our fearless leader in this work.
Well, thank you, Nadia. Hi, everyone. I think in taking a look at the participants here, I've got I think I know most of you, maybe not every single person, but it's good to be able to see our community so well represented and to be able to see people from such various areas being able to come together and to take a look at this work. If we can go to the next slide, please. So kind of the role that I've been playing is to help with the 2030 steering committee and to take a look at what our vision is for that and what we think we could achieve. And part of that vision is to be able to move towards this collective impact model. So there's kind of a progression, as you can see, and you're not always just necessarily in one bucket or the other. It's kind of a continuum and a spectrum, and we want to slide all of the work that we're doing to be able to get to this collective impact model. So on the left-hand side there, you can see the isolated impact, where There's a lack of coordination, a lot of duplication of efforts that are going on, maybe good work that's going on, but not necessarily coming together and kind of looking at the bigger vision within the community. Then the next area is the collaboration and partnership. So there's starting to be some common themes or some common topics. And it's maybe some of the same players who are working towards those goals. But there still isn't maybe a broader alignment or vision as to what we'd like to accomplish. And so we'd really like to get to this collective impact model where we have all of these partner agencies, all of these different representatives within the community who are working towards a common vision. It's not just, one organization's vision or Buffalo County Community Partners vision, but really it's our collective vision as to what we would like to accomplish. So we have that alignment across all different areas. We're sharing, we're coordinating, we're working together, even though, we may work in different organizations or we think we're in different silos, but together with this alignment and this vision, we can all accomplish and have a greater impact when we're taking a look at things with 2030. Just an example of that. So take a look at when people come together, what we can do throughout the pandemic. I mean, one simple example within our community, if you look at being able to serve 1,200 meals a day. So going from doing nothing and not having that service in place and having the community come together with the backbone of that being Hot Meals USA and then serving 1,200 meals a day. I know that there were folks on this call, Tammy Jackson and a number of other folks who are intimately involved with that. And that's an example where we shared a collective vision that, hey, we have a need in our community. Our goal is to serve as many people as possible and not have food insecurity and hunger during this time when people were unemployed and just the unknown of the pandemic. And within a very short period of time, we were able to come together and be able to do that. So that's just one example of how this model can drive success. I will turn things over then to Diane to be able to talk a little bit about the measurement piece.
Okay, thank you, Travis. Can we go to the next slide, please? All right, thanks. Hi, everybody. For those of you who I don't know or maybe don't know me, my name is Diane Duffy. I'm a professor of political science at UNK, and I'm on the Community Partners Board of Directors. And I currently serve as the chairman of the Community Partners Planning and Measurement Committee. So we are about the data. And anybody who's familiar with the work of community partners for the last several decades knows that programming is based in evidence and that data drives decision making. So it's been at the heart of what Community Partners has done for as long as it's been in existence. Now, when we start thinking in terms of collective impact, Travis made mention of this on the last slide. We come together because we have common goals, and the other piece of collective impact is the common measurement. And I think an important element of just understanding how collective impact works is that we get on the same page and we talk the same language and we share information with each other that lets us know, how well we're doing. Recently, the Buffalo County Community Partners Board of Directors made a formal decision to adopt a particular approach to measuring impact. And it's called a results-based accountability model. And you see on the slide there, it looks pretty simple. I want to say a little bit about RBA, as it's called. It was developed a couple of decades ago. If you I've seen articles on this dating back at least to 1995, and there are quite literally thousands of articles about applications of RBA in scholarly literature. If you go into Google Scholar and just search on that phrase, you'll get thousands of hits in scholarly publications. So this is not anything that's new. It is very well tested. It wants us to put the focus away from us and what we do and the inputs that we put into our work and switch that attention onto the outcomes, the people we serve, the effect that we have on individuals and communities. And the model is based on our ability to work together to answer three questions. How much we do. In other words, how many people do we serve? This is a kind of a counting statistic, right? How many people we serve, what programs we provided, what problems we tried to address through serving people, And then the second question asks us, to consider how well we did it. There are a lot of different ways that we can measure the quality. And then the third thing we ask is, have we actually made anybody better off as a result of the work? Right? Can we go to the next slide, please? Thank you. One of the things that's really interesting about results-based accountability models is that they kind of have us look at the intersection between the work individual organizations are doing, individual partners are doing, and the impact on the population as a whole. So we tend to think of data in terms of, well, this slide is showing it as population accountability and performance accountability. Other authors will use population level data versus program level data. And like I said, different authors characterize it differently, but that performance accountability or program level data focuses on the people that partners serve, right? Who have we helped? And population accountability focuses on, really, in the case of Buffalo County Community Partners, the conditions within the county. And these are the kinds of things that Buffalo County Community Partners has been measuring for decades. One of the appendices that came in the packet for today's meeting was the 2030 Vision Data Appendix. And if you look at that, you'll see that we've got tons and tons of statistics on conditions in Buffalo County. And that's what we mean by population accountability. And in terms of this partnership and this collective impact model, Buffalo County Community Partners will continue to gather those data at the population level. But the hope is that we can merge it with program accountability or program level data that is already taking place within the community. Can we have the next slide, please? Okay. This is kind of a different way of looking at answering those three questions in terms of effect and effort, and going beyond just what we do to what impact it has on individuals and on communities, and kind of those subtle distinctions between the how much we do and the how well we do it. At this point, I'm going to ask Denise to take over the talk here, because she wants to do some applications of this based on work that's going on in Buffalo County now.
Thank you, Diane. I am just very appreciative of the board's leadership in planning and measurement in selecting this model. I really think it's a model that will grow with us through 2030. So we thought we'd give you just a couple of examples of how we could see this being working, or how it has maybe worked in the past. For example, when we look at how much we do and how well we do it, I would say resounding across all, I think we're up to maybe 45 partners who are on the call right now. We do this well, guys. We do it really, really well. We're able to track the number of customers served, the number of people we serve. Let's say like this Saturday is our prescription take back event. We've got that down to a science. We know how many pounds of medications we pull out of the community. We know how many cars pull through. We know the quality of how well we do it. And then you begin to ask yourself that next layer. It's three simple questions, but when you get to that next layer of asking, is anyone better off due to the work that we're doing with a prescription take back? So have we improved anyone's skills, their attitudes, their behaviors, or their circumstances? And you tie that back into that population conversation, right? The population health conversation a little bit too. So I think it's something for us to really think about. As we engage with so many different funders, I think our funders look really closely at, this top tier. How much do we do and how well do we do it? And I think we're still trying to figure out, is anyone better off because of the work that we're doing? I also, Joanna Murray, who's our consultant from Nebraska Children and Families, who's provided us funding for this work, for community well-being activity, are really asking us to stay in that lower box, to really address that piece and to be considering the work that we're doing and how we're really changing skills, attitudes, behaviors, or the circumstances. And Joanna would give us an example of when she worked at the United Way, there was an employment education program. And they did a great job on the number of people they served, how well they did it. But when you start to ask the program designers, did anybody get a job? And did anybody keep that job? the challenges began to kind of circulate in their minds of how could we do that better, right? So I think we put the same scenario in front of the board of directors about a week ago. And we said, when we take a look at how we reacted to the pandemic, so when we knew we had a truckload of food to go out to people, we know how many people received a food box. We know how many we served every week. We know how many organizations come around the table to coordinate that. We could measure all of those. How much should we do? How well did we do it? We had quality food. We could tell you that we added protein that's never been available in our community. We did a great job with that. But then we ask ourselves, are people still hungry? Are people still looking for food? Are the people who came for food looking for housing? Are they homeless? Are there still food deserts in our community? Those are the questions we continue to keep asking ourselves when you get into that lower matrix. And I know Joanna is on the call right now. And I don't know, Joanna, if you want to do a shout out and maybe just cover anything that Diane and I may have missed.
Hello, everyone. You did a beautiful job in giving that quick overview. It's a hard concept to do very fast because it takes a little bit of time for us to be willing to move into that lower box to ask the questions about the effect of our work. And oftentimes we're a little hesitant to do that, particularly in our program level evaluations, because we don't want it to impact our funding, right? But as Travis said, as we move to that collective impact model, we're really giving each other the grace to say, what would be the shared goals in our community around particular issues or concerns that we're trying to address? And so if you just take your food example, I love what you said, Denise, about, can you go a little further in the question to say, how many families have returned week over week over week for a food box? What are we doing to help those families with some of their basic needs? And that pushes us past a conversation around food and puts you back into that conversation in a collective impact model with other partners at the table who would be able to address some of the additional needs in terms of housing or healthcare or employment. So it's a wonderful conversation that you're having right now. I think it's a great example that just really clearly helps people to think about what are the behaviors or the circumstances that might be behind that need that drove X number of people to show up at our food drive. So nice examples.
I think next we're handing off to Travis again. To the next slide, Matt, please.
Yes, thank you, Denise. So the 2030 steering committee, before I get into a little bit about some of the milestones of that process and what we've kind of gone through and accomplished to get to this point, some of the discussions that we've had along the way are what is our vision? And so we've talked about the results-based accountability. We've talked about the collective impact and some of those two key terms. And those are the vehicles for how we plan to accomplish it. But really our broader vision about what this is and what this isn't, is it's about bringing all of us together and together being stronger using our strengths. This isn't Buffalo County Community Partners saying, here's the data. Now all of you organizations, you need to do what we say. It's not that. You're already providing programs and services that are benefiting our community. It's helping us capture and collect that a little bit more so that together, collectively, we can show the impact that we're making within our community. So I just kind of wanted to talk through that a little bit, as I know we had a lot of time discussing that at our steering committee over the last couple of years. So milestones for our process. I remember when I first got involved, probably about 2.5 years ago. That was a long time ago. That was pre-pandemic. That was at the time when you used to be able to go have meetings in person. So I remember going up to the Buffalo County Community Partners office and actually sitting in person and getting a chance to talk to people across the table. And then I was overwhelmed, I'll tell you right up front. There was a lot of data that we were using at that time. Denise and her team, along with others, presented pages and pages and appendices full of data, which I believe you've got included in your packets here, at least some iteration of that. And so we started with this massive data dump and then decided, what do we do with this? How do we synthesize this? How do we turn this data into information? So over time, we have worked to be able to group some of these things into different themes. And then from themes, we have different data indicators within each of those. So after starting with just kind of this insurmountable amount of data, we've been able to refine this into areas of 25 different themes. And so those are 25 different data indicators, but those themes revolve around behavioral health, physical health, access to and also disparities within our community, and then taking a look at some of those youth promotive and protective factors. And really it kind of all drives back to what Diane was saying around our results-based accountability and our whole population, and being able to take a look at kind of the broader impact that we're able to do there. So if we want to go to the next slide. So, and more than just taking a look at the data as well too, once we had the data and the themes, we went back out to groups, much like those of you that are on this call and other groups, and said, what are we missing? Who have we, if we accidentally marginalized anyone or forgot someone, what voices are not represented here, so that we could have more of a holistic approach to being able to take a look at this. So really what you're seeing here, for many of you, this probably isn't the first time that you've either heard about or seen some of these, but we wanted another opportunity to come back and say, hey, we had all this data, we've turned it into information, we've grouped them into these different themes and have these different data, 25 data points that we're taking a look at. Many of you and others in our community have had a chance to see these too. Is there anything this far into the process that we could potentially still be missing? So just taking a look, I won't read through all of them, but you can see with our wellness, physical and behavioral, there's a number of different indicators in there around behavioral health, physical health, taking a look at those youth factors, a lot of things happening in school, home life, early childhood trauma development, some of those data that we're able to capture. Next slide, please. Our other two theme areas then, access. So access to care. Do we have access to mental health, primary care, housing? That's been one that, is for those of you that have been in the community or within this county for a while, there is a disparity between affordable housing and the folks that are looking for housing. And so the community has come together in the past to be able to talk through that. And so that's an area obviously that we've continued to identify. I think we're seeing more recently. I know that at my work at Kearney Regional, being able to grow our labor force is really important to us. It's at times difficult, and I'm sure many of your businesses and organizations are facing the same types of staffing challenges. So how do we look at growing some of those types of things? So those are the different themes, the different data that's going into each of those. And maybe we'll just take a second to kind of pause. We can back up a slide. And then what are we missing? So with all of that being said, maybe we'll just go through each area, allow folks a chance just to be able to kind of digest this again. But what under our physical behavioral, what wellness factors, what do you not see represented there that you feel as a community and as our scope within our county here that we should have some sort of data around? And you feel free to put them in the chat. We'll also be able to take some of those via email. So if you want to email Denise or Michelle or Matt or any of the Buffalo County team, we'll be able to capture that information. So I know it's a lot, especially with having 42 participants on the call here to be able to call folks out and to be able to speak up. We'll move on, take a look at some of the youth factors, the promotive and protective factors, anything there that you're seeing that we're not capturing at this point in time. Okay, we'll move on, excuse me, next slide. Back to access and basic then. What else there? What is there something that we're missing? I see. Denise, can you take a look at some of the questions coming in and
I sure can, Travis.
Capture those.
We can grab those. Becky Crano asked about environmental factors such as fall. Is that what you're saying? Like fall awareness? Is that what you're thinking of, Becky, as well as walkability and public transportation?
I was thinking more like I know there was a lot of work several years ago, pre-pandemic, about like community environment as it impacts wellness. So walkability, bike lanes, public transportation, those types of things. I don't know if that falls under access or if that falls under wellness or if that's increased physical activity.
The answer is yes. I think it's important for us to be able to capture that. I think it's not necessarily less important as to what column we painted in, but I appreciate you bringing that up, Becky.
Additional to that, Travis, Dr. Schaefer is asking around data on aging well, the ability to keep our elderly in their home, which I think is a fantastic piece. Tammy Jackson's also asking about parental support and involvement, if there's data that can be collected on that. And then Tana Miller's also throwing out access to quality childcare as another population-based data point.
That's great. We'll definitely capture those. I know that Michelle, well, boy, look at them going. Ask and you shall receive. Look at how fast they are. They're already getting those included in there. So yes, we'll take your feedback. We'll get that included and we'll see what type of data points we have available to be able to capture some of this information so that we can make some positive change in those areas. Really good feedback. I appreciate it, everyone. Anything else before we move on? Or anything else, Denise, that you would maybe comment on before we move on? Okay, well then I will go ahead and turn it over to Nadia.
Thanks, Travis. I'll wait for them to finish typing here and then we'll go to the next slide. There we go. So this slide is kind of a summary. Like you said, you received in your packet a lot of data, but this one is just a little bit of some data points that we picked to share with you. This is data that collected from Buffalo County. And so as you look through this, we're just going to spend a couple of moments here as far as what does this data say to you? Obviously, we can look at the individual data points and see that we have 24% of our children in single parent households. We have a 92% graduation rate. We have 632 children currently below the poverty level. So we can look at each of those points, but what we're really asking is for you to spend some time connecting those points and considering how some of these points affect each other or the other. So for example, the first data point that you have there is that for someone to rent a 2-bedroom home at minimum wage, they would need to work 70 hours a week, which is quite a task. But then when you look at that one in relationship to the fact that we have almost 2,600 children in a single parent household, then that brings to light issues with housing, issues with childcare, the possibility of a single parent working 70 hours while maintaining sufficient care for those children. So really that's what we're asking, is that you take a look at some of these data points and consider the connections. Earlier, we talked a little bit about the example in results-based accountability, the example of if someone got a job, did they keep the job? But then the next step in the conversation is, if they didn't keep the job, why not? Did they not have the proper skills, or were the expectations at that job such that it did not allow them to properly care for their children? Could they not find proper childcare in order to keep that job? So just that next step out in connecting these data pieces together and be able to ask those questions. So does anybody see anything off the bat that they would like to reference, or a connection maybe? Okay, well, hearing none, if there is something in your time that you spend reviewing this information that you would like to share, that would be great. But this is just an example of some of the different data pieces that Community Partners has over the course of this year tried to bring together and consider that that community effect. Yes, Denise says, if you're shy, please share in the chat box. So we welcome your input. So we'll go on to the next slide then. How did the data and community partners inform this work? So we'll get into this a little bit more on the next screens, but over 60 community partners presented to our board under these areas of access, behavioral health, physical health, and youth protective promotive factors. And so the outcome that you're seeing really was grounded in that information that was collected and garnered from the presentations to our board. We had asked partners to share their vision and their work in those areas. We asked them to answer these questions. You know, what is your hope to achieve in our community? What are your needs from a community perspective? What are your goals? What are your hurdles? How is the end user voice heard in this work, and how does it inform the decisions that you make? So that is a little bit about where we came up with the data that we are using moving forward. But we are still coming back asking, do we have it right? Do we have it all? Is this truly what our community sees as areas that need our focus for 2030 goals? So if we can go to the next slide. So, you know, the community partners has been doing this work for a long time. Our community has always made it a priority to work together to cross those sectors and collaborate in order to have better impact. So we have drafted some vision statements for your consideration to lead this work forward. Building on the work that Travis shared, the data, the information that was collected from the 60+ partners throughout the board meetings this year. The vision statements that we have drafted to go with this work are the 4 points here. So by 2030, our community will have resources that are easy to understand and accessible for all. We'll have access to basic services for all residents. We'll thrive when partners work together to coordinate services, and we'll value all people, and their voices will inform our work. So as I said, this is just a draft. It can be altered, added to, deleted, or revised in any way that you, our community partners, see fit throughout this process. So we will come back to this at a later date, but we did want to kind of present to you our summation of the work that has been done so far. Next slide. Okay, so what we heard from you. Just a little background for some of you who are on this, it'll be a review, but for others, we'll bring you up to speed a little. Since February, we used our board education time to host these listening sessions, and we addressed each of those theme areas, and we heard from partners working in those areas. We asked them to share with us tangible information and reflect on goals and hurdles. We weren't afraid during these meetings to really listen for vulnerabilities and to consider innovative actions so that we could really look at honest progress to help strengthen the connections and the partnerships, and to also sustain the work and meet new challenges. We were very intentional about the questions and the statements in relation to the collective model continuum, and really aspired to take the good things that are happening in our community and move them into that great area. So over the next few slides, we're going to review what we heard. And I would encourage you again to fill in what you see is missing. And we'll be asking you at the end of these slides if you have anything to add. So as we're going through these, if there is anything that stands out as far as, you know, you forgot this or you didn't consider this group, please make a note of that. So the first vision statement is that resources are easily understood and available to all. And this came from hearing that resources are not easily understood and are not accessible. And especially, this was especially brought to light through this process as COVID began, and we found crises in areas of resources regarding COVID testing that were available in other languages, regarding later on testing and other messaging that was coming, that it was just not accessible to all people in our community. We also heard that we needed a more cohesive or centralized case management approach. So we needed our people like Lisa at Salvation Army and Jubilee Center, we needed them to be able to work together and to be able to come up with a plan in cohesion. We also found that residents looked for resources when they were in crisis. You don't know what you need until you need it, right? So most often they would go to a friend or a trusted adult. So the conversation is, what is that first step? Who is that first step? How do we connect to that end user, whether it's through our churches or our schools or a city and county, to help promote that work? An example of what happened was Healthy Minds really took a front step to their focus on improving mental wellness when a lot of us were, stuck at home and didn't have those connections that are so valued. And in their promotions on social media, their talkbacks, the people that they brought to those tables really tried to address some of those issues. So that is what we heard in the area of resources. Ken Schaefer, our community members and our professional staff struggle to keep up to date with resources. Yes. So even when we feel that we are on top of things and we have access to all those things, sometimes the information is just not getting to people. The resources are not getting where they need to be. In regard to access to basic services, there are barriers in accessing services such as age, language, cost, location. We especially heard about these in the area of mental health needs. There was work as far as telehealth and providing residents with connections to mental health providers. There's barriers in access to technology, which we saw as far as providing reliable internet connections when we had kids at home and in need of those connections. There is a value of having the youth voice included in the conversation about solutions, and that was clear. But we did hear that those youth are not at adult tables and vice versa. So really a need to seek that cross-generation approach when we are talking about solutions. Community-wide stigma was recognized in areas of access and language, education, age, race, unmet needs, mental health, disability, abuse, neglect, or economic status. These stigma really were prevalent in respect to people who are in vulnerable positions. And one area where we see efforts being made is in the potential future of our youth in our early childhood development, in KPS's commitment to overcome this stigma with their work both at the Bright Futures Preschool and at the new Hania Rom Center for Success. So the recognition that the success of these young people is the success of our community overall speaks volumes to the work, but there is still work to do, and there are still gaps in there. Residents also have unmet needs for food, housing. As we talked about earlier in this call, there was a collective approach during COVID to distribute food boxes and promote local pantries, and a really focused effort to ensure that housing needs were met, that we didn't have people without a place to stay. But beyond this, in the conversation of what is that, the next step, the next question that we asked, were people really better off? And that is something that we heard from partners, is that desire to be able to walk alongside or coach these people to promote really long-term sustainable results. So yes, we can count the number of food boxes that went out, but the question is, were they really better off? Is there something more that we can do to promote that long-term sustainability. We heard of unmet needs in the area of transportation, connections, affordable childcare has been one that we have spent a lot of time on, immigration status, and then mental and physical health. So as far as access to basic services, this slide's a little bit longer, so there definitely are some areas where we have some work to do. The next slide, I think Denise is going to pick up on this one, and she's going to take you through some of these points, so you don't have to keep listening to me.
Thank you, Nadia. You did a fantastic job. And I know this feels really heavy because we're putting a lot at you at this point. And we just are so excited to share all of the information that you helped us build. But we know we're missing some pieces. So as you hear Nadia and I and Travis sharing and Diane, we're really looking for those things. What did we miss? And so be looking at this work as we kind of talk through it through that lens. So from those of you who were in the meetings, like I'm so excited. I think 75% of those that we invited are here today on the Zoom call. So thank you for making this a priority. That third area of the vision was coordinated services. So families thrive when partners work together. So what we heard, and I remember Dr. Edwards from Kearney Public Schools went on for a good 10 minutes talking about all the great work we've done around social emotional work, around substance abuse prevention curriculum, to multi-tiered systems of support, the MTSS pieces with schools, bringing suicide prevention curriculum into schools, and so much we've been doing in the realm of partners doing good work yet separate. We saw a lot of that adolescent risk prevention work happening in the community, but it still seemed a little separate, and it didn't seem real cohesive or in that collective impact model. So we recognize that. We've been doing good work. However, there's still much more work to be done. And then the second point, partners believe in healthy youth and adult relationships, yet a shared agenda was not easily identified. We could understand that, we could talk about it, but we didn't really know of anybody in the community who specifically is working on this. However, I see Carrie Gangwish from the Shelton Gibbon area. She's one of our youth from the Buffalo County Youth Advisory Board that has joined us. And I don't know if there's any other youth that have joined with the schools today. I know they were invited to jump on with their superintendents, and I saw Gibbon and Shelton, Pleasanton and Ravenna and Kearney Public Schools are all on this call, and Kearney Catholic. I think I saw Jesse on the call too. So thank you from those rural communities and school representatives from coming forward. And I think Carrie would agree with me that in our Buffalo County Youth Advisory Board conversations, that second point is talked about over and over and over and over. The youth are asking, how do we get adults to hear us, hear the concerns we have, and how do we work together? And we haven't figured that out yet. And so this is one of our attempts to bring them into this conversation. So welcome, Carrie, and any other Buffalo County youth that have joined us today, because I think this is a really, really important piece for us to be considering as we move forward. The third point, youth are struggling in our community coping with family dynamics, peer pressure, risky behaviors, building protective factors. And we're having a really difficult time reaching parents. If you really look at that data, that most single parent families are working 70 hours in order to pay their rent. No wonder we have a challenge getting partners to, or parents, there we go, parents to be part of the solution. When do you have time in a 70-hour work week to be able to be there for your child and those variety of different impacts? So we can see how that is all related and interrelated. We definitely saw that through the pandemic. One of the things we were posed the question of early on, where are the kids who were not in school during the pandemic? Where are the kids at, and what kind of supports do they need? And we really struggled with that. There's really no one in our community who's coming together around that piece to be able to provide those supports to youth in our community. So that become a large gap that the pandemic really highlighted for us. So if we move to the second slide, where we start with partners believe in early childhood development and have invested funds to support childcare providers, preschools, and schools. Yet we still felt that the shared agenda was not easily identified in our community. So I know Tana Miller's on this call. I know we have some providers on the call, schools who are doing preschool-based programs. I believe we would all agree that we've been doing fantastic work in the last decade in investing in early childhood. However, this might be the first time that many of the schools who are on the call today know that we actually have capacity building funds. So if they're looking to build capacity for childcare in your community, we actually have grant funds to do that. So we lack that ability to bring people together around this conversation, to be able to share those resources and help to support each other. Yet we all know it's really, really important to have those conversations and invest in early childhood. When partners doing the work were asked to point to the shared data, and that was that third question we asked all of you to answer as you presented to the board. You did a fantastic job talking about your program data, but as a community, we really struggled being able to communicate what we're doing together with that data, or what the data is informing us in a collective way. So we made note of that. And that definitely fits in this coordinated service section, as well as a system to track the gaps and the barriers in the community. I think we're doing some great work in different pockets. Like our community response team is doing a fantastic job with providing flex funds to those that need housing or utility payments when there's no other resources available in our community. So we're getting a system to track those gaps, but we still have quite a bit of work that we could do in the area of youth and being able to figure out how to support youth who are in need, maybe homeless youth. How are we ensuring that our youth all have homes and supports and services? And the last one on this one, not all partners are at the table to discuss the work. We definitely saw that we did not have the rural community voice represented in a lot of the conversations we have. I'm really grateful that those of you who are from those rural communities in Buffalo County have joined us today, because your voices are really, really important to this work. So maybe you're thinking of some things that we're already missing that this conversation is spurring, or this presentation. It's not really a conversation yet, is it? I'm going to move to the next slide of value all people. I've got 2 more slides, and then we're really going to start talking about what did we miss? What are you all knowledgeable of that we've missed? So the fourth area of the vision statements that we shared was that we value all people, and their voices will inform our work. So this really speaks to what we learned through the pandemic. And this was the first time Buffalo County Community Partners organized around voices of those underserved, specifically non-English speaking residents in our community. When we started to see that we had an increase in the number of Hispanic and Latinos who were non-English speaking and had diagnosis with COVID, or had tested positive, we didn't have any information in our community that was able to be shared to help educate that particular population around the risks and prevention of COVID. So that really brought an amazing group to the table. So a lot of this we have learned from them. And I think Michelle Warren, our champion out there, is on this call too. So thank you, Michelle, for bringing a lot of this to our attention. But a shared agenda around community inclusion and embracing diversity was not mentioned very often. However, partners are very willing to discuss this. There's definitely a readiness to have these broader community conversations, but we could not really see anybody in the community who really was taking the lead in this work. Celebrations, best practices, and evidence-based practices are known. Those of you who have been in this work and around the table, you know these best practices. Yet many in the community have not heard about them, or they may not know the success of what's been working in our community. Do we know that every school in Buffalo County has social emotional curriculum, Second Step? They have access to funds to put Second Step into their schools. How do we know what impact that curriculum has made overall within Buffalo County? So those are some of the questions and things that we've talked about. Residents with lived experience are being served by services. The data informs those agencies and the agency programs. However, that lived experience rarely informs our community decisions. And I think this is one of those fairly large, significant gaps that we've identified. We do not have a lot of community-based data that helps us understand what it's like to live in our community as a 17-year-old youth from Shelton. So thank you, Carrie, for being on this call. And I'm sorry I'm picking on you, but those are things that we need to know. We need to know those families who are coming through and getting food boxes every week. What other services and supports did they need? There was times when people would come through and have a conversation and be able to talk more about that work. I'm sorry, was somebody trying to talk? And the last one is lived experience of parents was not heard, except in some schools. And I think, Vern, you're on the call from Gibbon. I remember you talking about having a parent group that really helps inform your schools. And I was really impressed with the pieces that you brought to the table for us to hear about, including parents in the conversations of how you make decisions within your school. So I think, did I get through? Oh, one more slide. Sorry. Are you on the same slide as I am, Matt? I'm sorry. I'm kind of looking at a different one. Yep, we are. Okay. So youth and adults have similar views, but conversations do not exist in our community where they talk together. I think I've already kind of mentioned that. The schools were very upfront with us that they're over-surveyed, that we over-survey our students. We also heard very clearly from a minority population that they're over-surveyed, and they don't always know what the results of those focus groups and surveys are and what that means to them. So we're surveying a lot, but we're not necessarily bringing that information back to those people that we surveyed or bringing a greater understanding of the information that we've collected in our community. And I think Nadia mentioned this at the beginning in the access area. Our partners excel at case management. I think I saw Lisa Leith from Salvation Army and Sherry Clark from the Jubilee Center and Carrie Oliver. I think Oliver, I saw you on this call. Ladies, you by far are the most outstanding case management people I know. You do amazing work with limited resources. And we heard that over and over again in the information that you were sharing with us. Overall, conversations that we've mentioned through all these key findings are conversations at coalition levels and our collaborative meetings that we have throughout the community. However, as a staff, as we talked about these things that we're sharing with all of you today, we don't feel that a lot of these pieces are in the center of the conversations. They're like side conversations. It's like, oh gosh, if we had time, we'd really like to work on this, but we're really not taking it and putting it right in the middle of the table to say, how do we develop youth and adult relationships? How do we make that stronger in our community? I think that's the last slide I have. We want to open it up at this time to say, what have we missed? And feel free to share that in the chat box. Or if you would like to speak, I'll be quiet now and open the floor for others to share.
I've always had a little bit of problem. We've divided into youth, we've divided into adults or parents, but youth grow up to be adults, and there does not seem to be anything to help with the transition between youth and adulthood, and for that matter, adulthood and aged in that respect. So we've kind of pigeonholed these groups, but it's a continuum rather than just a defined line in the sand.
Thank you for sharing, Ron. Other observations as you guys are hearing this information for the first, second, or third time? We sure value what you're hearing or what you're thinking we've missed so far.
Can I just kind of like touch on what Ron was saying?
Yes, please, Carrie, do.
I definitely would say I'm even seeing that in my own household, and like my parents are having a very hard time with me like understanding that I have to have a transition out of my house instead of just going straight from being this little kid that my parents still see me as to now I'm living on my own and I don't have any rules. And I would say that that's very important for parents to understand, because I really don't feel like they do, even though they experienced it themselves. And also there was a slide that talked about parents and youth using like drugs and alcohol. And to touch on that slide a little bit, I would say that I'm mostly seeing that parents focus more on the punishment side of things than trying to connect with their youth. And I would say that that's probably one of the bigger issues surrounding that specific topic.
Carrie, thank you so much for joining us today and sharing those perspectives. This might be the first time that many of the adults on this call have heard that perspective and probably need some time just to process that. And I believe this is the beauty of where we could go next, is having more of these conversations of what you're sharing with us, Carrie, and truly listening from adult perspective and truly listening from a youth perspective. And to throw in what Dr. Schaefer's saying, even at the grandparent level or the isolated seniors, is just truly living and learning through the lived experience, and really trying to make those connections versus isolating or siloing those particular populations in our community. I know there's a lot of comments coming in, so I'll try to process what I can. I think I saw something from Carrie or from Jamie Legates. One thing we're exploring here at Families Care is to support youth involvement in our systems of care and developing youth leadership programs or curriculum, which is fantastic. Thank you for sharing that, Jamie. We have done this for parents, family members with lived experience. We would like to see or develop something similar for youth, which is fantastic. And I don't know, do you want to talk a little bit about that, Jamie?
We're just currently, we're just about finished with a SAMHSA grant that we use to develop the Parent Leadership Academy, which really is targeted at giving parents tools and skills to participate in different boards and community organizations, committees and things like that, and also facilitate groups of their peers where they could provide support groups in different areas that we can't reach everywhere. So using that model and seeing what that has done for different parents, you know, we're beginning to explore what that might look like for youth. You know, I do think we have a lot of youth that identify and are willing, but I don't know that we've given them the tools that they need to be leaders in the community, to be confident enough to sit on committees and know what their part, you know, how they can participate effectively. So, you know, we've reached out to a couple different organizations. We've talked with some of our supporters at SAMHSA, and so we're just exploring that right now. We haven't taken too many steps in that direction, but I think that's probably our next big project we're planning to tackle.
That's fantastic, Jamie. Thank you. And she's with Families Care, which does fantastic work with peer support in our family, with mental health, substance abuse pieces with families and youth. So thank you for sharing, Jamie. I know there's other partners. We have law enforcement, Buffalo County Attorney's Office on the phone or on the Zoom call. Are there anything else that you guys see missing in this information, or ditto, agree? Nice list.
Yeah, I think you've captured a lot of things. So, I mean, it looks good.
I would second that, Lacey from Rich.
Thank you, Lacey, and thank you, Neil. Chief Wah, are you still on the call? Anything else you see that popped up?
Heather, yes, I am. I didn't want to be that guy who says, yeah, I agree with everybody else, so I was staying silent. Wonderful job. I think you raised a lot of great direction for us moving forward as a group. So we appreciate the opportunity. And, you know, I really like listening to conversations about the need to have a greater impact on early childhood and with the youth. That's something that the sheriff and I both have as a high priority from the law enforcement side, knowing that if we can get to these kids, the sooner the better, to steer them down a path of success. So good ideas.
Thank you. We will be moving here shortly into the next question, which will be, are you interested in sharing this information with more people? So we want you to be kind of thinking about who else would you invite to the table if we share this information at the next step or the next level. So be kind of thinking about that. Before we move that direction, though, I know we've got some great school representation on here, as well as our rural communities. So I don't know if any of our school superintendents or counselors who are on right now, is there anything we missed from your perspective?
Denise, I think, I've been in several meetings. I think you, as Sheriff Waugh stated, you've put together a great list. Again, there's a lot of work. We've done a lot of work and there's a lot more work to do. I think finding those relationships for us. The Hanny Around Center for Success is a great starting point. Our hope is obviously to continue to build the mental health supports for those students as they become adults. It's also to find community partners who are willing to engage in school to work opportunities. We're big believers that if a student sees a direct correlation or connection to the workforce and maybe opportunities beyond high school, that those carrots to graduate, those carrots to complete their education will grow that much more. And that's critical that they graduate from high school in order to not end up being an adult that we have to serve in a different capacity in Buffalo County.
Thank you, Jason. I appreciate that. Any other comments from our school representation? I always leave those uncomfortable pauses because I want to make sure people have a moment to collect their thoughts and share. So I know we have quite a few service providers on the call as well. Lisa, I saw you on here. I believe Angela with Kearney Works, Shelley Witt with Department of Health and Human Services. I know there's more, but community service providers, anything that we've missed?
This is Shelley Witt. I could not think of anything that you missed, but I did just want to say I really appreciate having the youth voice on in this group. It's so valuable for the things that we as adults don't think about. So thank you for that.
Yeah, that's something too. We wanted to figure out how to weave the youth voice into these conversations as well as the childcare providers. So that was why we're kind of at this time in the afternoon. We were hoping childcare providers were having nap time and would be able to call in. And I don't know if any of those are on the call. Tana, you might have to give me a thumbs up or a thumbs down or something and let me know if they are, because I would definitely call on them to share. But we would love to focus on bringing more people with the lived experience versus just those of us who've been at these conversations for a while. It would be refreshing to hear some of their thoughts as well. So feeling like we're getting to a point where we've been able to share quite a bit of information. I did see Carol Renner ask about human trafficking. I kind of wondered, I have not heard that piece come up. I know it's something that is near and dear to many of your hearts. And so that is something we can add to this piece because it is missing. And I know that we have fielded several calls in the last month and forwarded them to a few passionate people who have been talking a little bit about human trafficking prevention. So I know there's some work starting, but I don't know that there's any central coordination to that work. Nadia, I think I will hand it back to you for the last slide or two.
All right, thanks. Great conversation. Okay, so in summary or next steps, as we told you at the beginning, what we're asking is, would you be willing to join us on this journey? And some of the roles that we've talked about at our board meetings and with partners are really considerate of the end results. So what are the end results that we want for our community? And we hope that we captured some of those in those vision statements. But if you can really just try to imagine what are those end results that we want? What do those goals look like? And in order for us to reach those, who do we need to be a part of that conversation? So inviting other partners to this conversation would be one role. The other is to help point to shared agendas. So if your work is already in these areas, to take some time reviewing some of this information and to help us to make sure that we are identifying a shared agenda. Another role would be to coach or to educate partners on collective impact. For those board members that are on this call, I think it maybe has become kind of a four-letter word. I don't know. Or maybe we're just getting past that. It was for a little while a four-letter word. So we heard a lot about collective impact, but really I think that we are, we've rounded the corner a little bit to the point where we're really starting to see how the work that we are currently doing can be tweaked really to get us to that great level. So if it's something that you feel like you have rounded that corner, that you have a better understanding of collective impact, and that you would be willing to help us coach or educate others in that process. The next one is asking questions to drive impact. Really those questions come from all community members, but they especially come from those with that lived experience. So, if it's just sitting down to have a cup of coffee with someone and asking them, what was your experience when this happened or when that happened? Really asking those questions to make sure that we're being very thorough in that information, and that the impact is achieved. And then the last role is develop an innovative model to achieve the greatest impact. Obviously, we've been having vision conversations for a long time, but we're really at a point where we're starting to put pencil to paper in coming up with a plan and a model to implement some of those goals and benchmarks and achieve that impact. So that is our ask to you, is if you would be willing to join us on this journey. Denise, did you want to?
I think just for visual effect, if I could ask Matt to stop sharing, and then let's just do when we stop sharing here, let's just do a visual thumbs up on your reaction or thumbs down. Are you willing to continue this conversation by inviting others? That's our ask. Is this worthy of additional conversations and bringing more people around the table? Thumbs up, thumbs down. Okay, thank you. I was assuming that's what you would all do, but I just kind of wanted the visual, so thank you. Plus, I just wanted to see all your faces at one time. So yes, Nadia, the next question is, who needs to hear this, guys? I think Cindy Powell already jumped in there and said, does Voc Rehab and Goodwill? And I'm hoping Cindy would be, yes, she said she would. I see that now. She'd be very willing to invite them. If we want to bring the PowerPoint back up, we have the next meeting. We would be running through the same PowerPoint and asking the same types of questions for others. So who needs to hear this? And you can drop that into the chat, or we would ask that you help us by inviting people that you know within those areas. So if you are making some recommendations, we really would love your support in helping to reach out to them and invite them. That would help our team out tremendously. We're getting some great ideas. Thank you very much. Joanna, you have an interesting thought too that you wanted to leave with us before we end. Do you want to share a little bit about maybe some ways to share this information amongst the partners on the call?
Well, I was just thinking about all of you are members of teams in your home organizations, and it might be interesting since you got the materials in advance, if you would share this at an upcoming staff meeting or team meeting and just gather feedback from your individual organizations that you could share back with Buffalo County Community Partners so that we continue to flesh out this. And we know we gave you a lot of important information today, but we gave it to you very quickly. And we've had the benefit of noodling on and thinking about this for a number of months now, and it's not fair for us to expect you to gather it all in one shot. And so we thought if you had an opportunity to look at particularly the groups of sort of the information that we've culled and discerned and what's missing, to have that conversation with your teams and maybe share that back with us, that could be really helpful. So if we gave you a little bit of time to share it back to us and then maybe invite some of your colleagues to attend the November meeting, that would be really terrific.
Thank you, Joanna. And I love the list and it's coming together. So again, those of you who are making some of those recommendations, we would love for your help in extending people an invite to that meeting. We should be able to get the invite out to all of you yet this week. So it's something that you could forward on to others. We'd be very willing to share the PowerPoint with you if you wanted to share at your team meetings. And if you wanted myself or any of our board members to come along and share or Zoom in, we'd be very willing to do that. I think the interesting challenge for us is to consider people with lived experience in our community. How can we bring more people with lived experience to this conversation? Do you have people that you could connect? And I think, I'm sorry, I can't remember who said we do need to consider maybe some education or training to help bring those voices to the table too, because we want people who are joining this conversation to feel welcome, invited, and very much a part of the conversation. Does anybody have some ideas of those with lived experience that we could invite or that you would be willing to invite?
This is Jamie at Families Care. We do have some local parent leaders that have been trained through our Parent Leadership Academy that I could reach out to and see if they'd be interested in participating.
That would be fantastic, Jamie. Let us know what support you need from us to help with that. We do have some funding too, and I know I think we talked with this with Carrie as well. But Nebraska Children and Families is very willing to pay a stipend for those who are not already getting paid for this. I think almost everyone outside of Carrie on this call are getting paid as a part of their job most often, unless you're retired. You're getting paid to be here to be a part of this conversation, or it's important to your organization. So that's why you're here. So if funding for those parents to be on this call would be a barrier, we would sure talk about how we could support that in either some sort of stipend for that type of encouragement to join us. Well, fantastic. It looks like we have good support moving forward on November 16th with inviting more partners to hear what we've got to share. We as the collective community partners on this call. Nadia, do you have anything else you want to share?
I don't. I just want to say thank you so much to everybody on this call and for your commitment to our community. And I really look forward to seeing next steps.
Joanna, any words of wisdom as we step away from this Zoom call?
No, I think this is really a great starting conversation with this group and look forward to the continued feedback and input that you all share with us.
I would love any comments that you want to share with me via email or chat. What could we have done better to improve this presentation for all of you? What would you like to see more of, less of? We would love that feedback since we will be sharing this additionally to more partners. So any feedback that you give, more snags. Thank you. If there's any other interesting thoughts that you have, we would really value your insight in that as well. So thank you so much.